Good morning. Good morning,
Good
Dr.
morning.
Schwarz with the Cleveland Clinic. It's bright and early Monday morning, 7 a.m. for me and 8 a.m. for him in great Ohio. Dr. Schwarz, thanks for being on Brave. How are you doing? I know the COVID has changed kind of our universe, and for you at the Cleveland Clinic, how are you?
Well, doing well. I hope everyone's staying healthy out there. We're slowly kind of re-establishing more and more care for patients. So this week is going to be, sort of the beginning of our more gradual ramp up back to, hopefully some semblance of normalcy. But, I think everybody has taken things in stride and, have acted as a team to make it a safe place. So.
Yeah, it looks like Ohio is starting to open up a little bit. You might be able to take your family out for an ice cream cone at some point, right?
That's right. That's right. We luckily had some nice weather this weekend. It was snowing a week ago, but it was nice this weekend.
It was beautiful, as long as you use your sunscreen. I'm just gonna, for the audience out there, some people may be watching live. It looks like we have some people live, and then some will be following up. What Brave's been doing, we actually started out 9 years ago as a 501c3 to help breast restoration advocacy and education. That's what Brave stands for. But that doesn't mean we're forcing, reconstruction on women. That's why we use the word restoration, just to educate women on their options. Today, we're going to talk to Dr. Schwarz about some work he's done in this area. But I'd like to just give his background because he has an incredible one. Undergrad at University of Penn. And then he went on to, looks like he stayed a long time in New York City. I've lived there as well, and I love it. He was a residency at Cornell. He also did his plastic surgery there at New York Presbyterian Columbia University. And then he also served as administrative chief. He went on to aesthetic surgery training at Manhattan Eye, Ears, and Throat at Lenox Hill, all great places. Microsurgery reconstruction fellowship at Memorial Sloan Kettering. And I think that's important to point out because we talked a lot last week with Dr. Johan at Cleveland Clinic, how important the microsurgery component of this is for plastic surgery. And of course, he's board certified in plastic surgery and is professor at Cleveland Clinic. I could probably go on some more, but I think Dr. Schwarz probably thinks that's enough. So we welcome him. And I've never met you, Dr. Schwarz, before, but I've read a lot about you, and it seems like lymphatic is an area of real importance to you in your work. Maybe for people that don't understand lymphatics, or they've probably heard if you get cancer through the lymphatics, that's not a good thing, but maybe tell us a little bit about the lymphatic importance, how it relates to the blood, and then we'll get into some of your work.
Well, thanks for the warm introduction, Christine. As it relates to lymphatics, I think it's something that folks with especially a new diagnosis of cancer, need to be familiar with. When folks have cancer surgery, especially when we talk about breast cancer surgery, one of the major components of sort of evaluating their care and some of the treatment decisions are based on involvement of the lymphatic system and the lymph nodes, certainly in the armpit and in the central chest. And that's going to determine, sort of their surgery types, as well as, to some extent, other treatments such as chemotherapy and radiation, as well as, the need for removal or treatment of areas that are affected by cancer, that have lymph nodes and lymph vessels in them. So to that extent, it's important to kind of understand a little bit about what the system does. It's essentially acts as a cleaning system and an immune component where you have blood which flows from your heart to your limbs, and then veins which bring the blood flow back to your core. But some of that fluid doesn't stay necessarily in the arterial and vein system. It goes out through the body tissues, and those tissues need to be cleaned, and the lymphatic system does that. It also senses and is kind of a monitor for cancer as well in that regard. So it's really quite an important and often overlooked component of your your body.
Yeah, I've heard a lot about it recently, and that it is overlooked. And but when you get cancer, and people talk about, is it in the lymphatics or not? That's when people start worrying about the lymphatic system. So, in regards to breast cancer, and if you remove a lymph node, I've read your article that I'll mention a little bit later. We'll send the abstract out. When you remove the node, that's when the lymphedema can come into play. Is that correct?
Right. There are several things that can contribute to dysfunction in the lymphatic system, and certainly the probably a highest risk of injury to the lymphatic system, of long-term problems with the lymphatic system, comes with removal of lymph nodes. Now, thankfully, there's been a trend away from removing a lot of the lymph nodes, right? With techniques where maybe one or two or three are sampled. That's called sentinel lymph node biopsy. And with those techniques, you're able to kind of establish, whether or not there's cancer in the lymph nodes, and it allows you to spare a lot of the lymphatic system without injuring it. And similarly, some folks are having less actual surgery on their lymph node system and having radiation. Radiation in and of itself can actually injure the lymphatic system. So I think that if there are ways that we can avoid doing surgery to injure this, this system, we can decrease the chances of having long-term dysfunction. And that long-term dysfunction that I'm talking about is a condition called lymphedema. And we can talk about that a little bit if you like.
Yes, that'd be great. I think a lot of people don't understand what it is. I recently read a lot about that, try to understand it. It is quite confusing.
Sure. So lymphedema is a scenario where, again, there's an injury to the lymphatic system, and what that can do is it causes obstruction of this lymph flow. So the lymph flow can't travel normally back to the core of the body, and the lymph can't flow back into the bloodstream as it normally does. So when this lymph fluid is obstructed and accumulates, it can set up a condition. And for women who've had breast cancer, typically this occurs in the arm. It can set up a condition where the arm can accumulate fluid, and that fluid is very protein rich, and when sort of stagnant, it can set up a system where it damages the remainder of the tissues in the lymphatic system that's present in the arm. Some inflammation sets in, some low-grade inflammation sets in, tells the body to deposit not only more fluid, but scar tissue and even fatty tissue. So over a long period of time, if this condition isn't treated, there can be this accumulation of both fluid and a solid component of tissue. And it can be cumbersome, it can be debilitating because the arm is getting bigger, it can be heavier, painful. It can impact women's daily activities. Can be quite limiting.
That's terrible. So it's basically the body's fighting it off to have an inflammatory response, but eventually that's such a debilitating thing. Is there any further consequences of like amputation, or does it just really stop there and you just can't do much?
Well, thankfully, that's a very rare, occurrence. I think that for most folks who develop swelling in their arm, which can be attributed to lymphedema, especially in folks who have had cancer surgery, typically physiotherapy is kind of the first line of defense. Watchful, surveillance after these types of surgeries, and then physiotherapy in the form of compression, massage, bandaging, and these types of things are typically thought of as first line, and they can help remove some of the fluid from the limb and help sort of stop progression. However, these things can be quite cumbersome. These treatments, they're quite time consuming. There are some folks who spend hours per day trying to manage this condition, and it's great. We're actually getting much better over the last years at actually curing cancer. So now there's increased focus on, well, have we created a scenario where there's problems from the treatments that we've offered to cure cancer? So I think that's where increased recognition of lymphedema and lymphatic dysfunction comes in.
So to get a little more technical, and pardon me if I say anything wrong, so the article that Dr. Johan sent me that you are lead author on was last year, February 2019, that talks about reverse mapping lymphatic bypass sounds like you're doing something to kind of see what's going on in the lymphatics and try to prevent further removal of lymph nodes. Did I get that right? You got it.
So, well, it's not per se to prevent removal of lymph nodes. In fact, this is a technique that we have been working with for about 3 years now. And we've been using it primarily in women who have to undergo complete removal of their lymph nodes because they may have some cancer cells in their lymph nodes in their armpit, right? And so whereas there are those women who are able to just have some lymph nodes sampled, and if there aren't any cancer cells, they don't need the rest of their lymph nodes removed. But there is a certain segment of women who have cancer cells that are in a number of their lymph nodes. They have to have the remainder of their lymph nodes removed. So when we do that, or when the breast surgeon does that, what happens is it creates a gap in the lymphatic system, right? Because the lymphatics are cut. And so you can think of the armpit area as a crossroads, an intersection point of lymphatics that drain the breast, the lymph fluid from the breast, but also lymphatics that drain the lymph fluid from the arm. So now we have this intersection point. So what we have started doing at the Cleveland Clinic is we started trying to map out the lymphatic channels that are draining the arm, okay, and separate them and identify them from those lymph channels that are draining the breast, okay? So it's inevitable that when you do a cancer surgery, you're going to have to cut some of the lymphatics that are draining the arm. But when we do that, there's an opportunity now to mark them. We can see them better if we do this lymphatic mapping procedure. Okay, we can ask our breast surgery colleagues, breast surgical oncologists, to identify them and mark them for us. And then we, as plastic surgeons and microsurgeons, we can actually reconstruct the lymphatic pathways. And that's something that is, a little bit novel, combining these techniques.
That's amazing.
So that's the essence of what we're trying to do. Not only are we trying to identify the channels that have been cut, but we're trying to reestablish the drainage of the lymph flow from the arm once they're cut. And we do that using microsurgery techniques.
That's honestly, that's so groundbreaking. And I think for the viewers out there that will be watching this, if they're going to a surgeon, I think one thing important that you just brought up is that great teamwork the Cleveland Clinic has with the breast surgeon and the plastic surgeon, microsurgeon. For women that are in maybe areas that don't have such a unique team approach, what advice would you give women if they're hearing that there's lymphatic issues, et cetera? Like, is there resources online you direct them to, or any advice? I know you can't give doctor advice to people that you don't see, of course, but just any general advice for those women.
Sure. Well, I mean, I think just actually being aware of some of these issues and some of the some of the after effects of cancer treatment on the lymphatic system. I think that's step one. Awareness is clearly step one. There are a few centers across the country that offer this type of technique at the time of cancer surgery, and quite frankly, not all women are going to have access to this technique. And as you well know, not all women have access to even breast reconstruction, right? So this is something that is even a little bit more nuanced. So, I think what's important is that, educating yourself, being aware of signs and symptoms of new onset swelling. If you notice your ring doesn't fit, or you're feeling heavy or achy in your arm, that's something you should see your doctor about. And oftentimes, we recommend that someone see a lymphedema therapist, certified lymphedema therapist. And that's a good first step.
That's great feedback. That's one thing I think Brave is really about, giving those resources. And I think maybe what we can do on our website even is find those lymphedema experts and try to map them out in the United States. I don't know how many there are, so that's a good thought. There's probably a limited amount in the whole United States, correct?
That's correct. That's correct.
That's wonderful. So Dr. Schwarz, I know you probably have to get to patients pretty soon. We try to keep these 15, 16 minutes, which we're at. We'd love to have you back on. What we'll do is circulate this video, see if women have questions, because I think this is a topic that, like you said, the lymphatic system has not been really focused on so much. And maybe in the last 5 years it has been. And thanks to the work you're doing, and wonderful work. I really appreciate all you've done, and look forward to more papers from you so we can learn some more.
Well, thanks so much, Christine. It's really been a privilege to be on this morning with you.
And the same to you. Good morning.